In Spain as well, seems to be doing much better. Want to bring in Dr. Seema Yasmin. She's a public health professor in Dallas and a former disease detective at the CDC, and Dr. Frank Esper, an infectious disease specialist. Dr. Yasmin, I want to start with you. Since you are in Dallas, you're part of that community there, where now more than 40 people have been released from varying levels of restrictions and quarantine. Is this a big moment down there? How is it being received?
Absolutely. There's a big feeling of relief here in Dallas that about 40 people have been released from quarantine or from self-monitoring. It's very reassuring. It reassures the public again that that risk of Ebola can be quite low when you haven't had very much contact with an Ebola patient. So I think lots of happy people in Dallas, of course, still watchful, waiting for another 100 or so, or just under that, who will still have to be monitored for a few more days.
Meanwhile, more cautious optimism, I suppose, when you look at the situation in West Africa. We know that the numbers there are still increased, and that is a cause for concern. However, Nigeria, Dr. Esper, as an infectious disease specialist, you can talk to us about this. We know that Nigeria, the nation of Nigeria, said we are Ebola-free. We essentially have had no new cases. What can we in the United States learn from that, and how much of a victory is this seen in the battle against Ebola?
Yeah, it's not just in Nigeria, but also in Senegal, where they really, with very vigorous techniques and control of exposure and monitoring of those people who were exposed, are able to stop the virus with not as much infrastructure as we are used to here in the United States. So I find that not only is it very reassuring to me, for people here in the United States, but it should be very reassuring to people around the world that it doesn't take sophisticated techniques to control this virus.
You know, it's nice to get this good news, from Senegal, Nigeria. It's nice to get relatively good news from Dallas. Nevertheless, there's still 4,500 people who have died, more than 9,000 infected from Ebola in West Africa, so there's a lot of work that needs to be done. We are, though, looking at some of the measures we're talking about here in the United States, Dr. Yasmin. The 21-day incubation period, that's the period that has expired for these several dozen workers in Dallas. Do you think 21 days is enough? There are some members of Congress now, albeit not medical professionals, who say it should be more than 21 days.
So we really have to look at the medical professionals who have been doing this for about 4 decades now, dealing with Ebola outbreaks and safely containing them. So let's look at Doctors Without Borders as a really good example. They use this 21-day monitoring or quarantine period, and it's worked really well for them. So overwhelmingly, the science backs this 21-day period, and we need to reiterate this so that the 40 or so people who've been released from monitoring today aren't stigmatized, aren't discriminated, and people don't fear them questioning, well, is 21 days enough? The science says that it is.
Abundance of caution seems like wouldn't be a bad thing to add to that, the 21 days. Dr. Esper, final question to you. We've been hearing about this rapid response team, the idea they would sort of, scramble to an area that has a new Ebola case should one arise within 72 hours. When I think about it, given the way Ebola spreads, how quickly it spreads, how highly infectious it is, 72 hours doesn't feel
a lot can go on in 72
it doesn't
hours.
feel like really rapid response. Give us your feedback and thoughts on this.
Yeah, certainly we would like an immediate response. However, you have to understand that everyone who presents to an emergency department or an outpatient clinic who is sick is not necessarily all of them going to have Ebola. It does take a little while for us to actually diagnose the disease before we can respond to the disease. It's also one thing that you can take some reassurance about is how this virus works. The ability to transmit this virus from person to person gets higher the sicker the patient gets. So when the person first shows up with symptoms, similar to what happened with Mr. Duncan and his contacts in Dallas, they were exposed to him when he was just starting to have symptoms. That's not a lot of virus in his body. However, the sicker you get, the more you get bedbound, the more you get critically ill, like what happened when he was being cared for in the intensive care unit. Then you're teeming with virus, and then you can spread that virus a lot more easier. So the first 72 hours after you start having symptoms, when you are calling for this rapid response, there's still probably in a very low amount of virus, so the spread from person to person, while not zero, isn't going to be as high as when they're in the intensive care units.
That explains why those 2 nurses were sick. And Dr. Esper, Dr. Yasmin, really great to have you back with us. Hope to see you again soon, okay? Ahead of this hour, the